Welcome, participants. This is Dr. Richard Wilson, and I'll be your host as we work our way through this needs assessment webinar, and we'll be reviewing some of the principles and strategies of the common practice called needs assessment. This next slide should be familiar with many of you. It portrays the core functions and basic services of public health, and you'll notice one of the core functions is assessment. And so you'll see that is a key element of all of the core functions, and two of the basic services kind of feed into needs assessment, and those are monitoring health and diagnosing and investigating health problems. Those are some of the sources of data that enter into a needs assessment procedure. In any case, I just want you to note the importance of assessment in the overall picture of public health. It's a very important part of what we do. Just to get us started, I'd like you to think about the community where you live, the town, the county, the state, and identify just informally, just from your own imagining, what are three important health problems in your community, and how would you rank them? Which one is most important, next most important, least most important? Obviously there isn't a right or wrong answer there. This is a subjective opinion I'm asking for, but give it some thought and see if you can identify three and then rank them. I'll give you a few moments to do that. So that is in sort of a mini form what we're talking about with needs assessment. We're trying to identify what are the priorities that we should try to address as we design interventions, as we allocate investments of resources, as we organize our communities to address certain things. We want to identify data-based evidence for choosing and selecting certain problems to address, and to essentially neglect or overlook other problems because they don't reach the level of a priority. So what do we mean by health asset and needs assessment? I want to clarify here. Traditionally, we've used the word needs assessment or the term needs assessment. More recently, we've begun to recognize that not only do we want to identify problems, but we also want to identify resources. And so some of the items in this slide are on one side or the other. We want to know what's the nature and extent of health problems in our community, and which ones should be priorities. We want to know the most common causes of death, disease, disability, and so on. But notice the last one, we also want to know what resources are in place that we can use and build on to improve health status where we live. This slide shows where needs and asset assessment fit into the scheme of strategic planning. So every organization has a mission and a vision statement, and based on whatever those are, we might conduct a needs assessment, need and asset assessment, to find out how we stack up, or what's our stock with respect to our mission and vision. And then the need and asset assessment leads to goals and objectives, which then feed into the elements of the program we're going to design. So that's sort of the scheme of where we're going with this. So I want you to imagine, we're going to sort of play, let's pretend. Imagine you are a public health worker. Maybe you don't have to imagine, I suspect many of you are, but if you're not, imagine you are a public health worker, and then just in your own words, very briefly, try to identify what is the mission of your agency. Why do you exist? What is it you're trying to do on a day-to-day basis? How do you contribute to the public's health? I'm not expecting a fully fleshed out mission statement, but in just a few words, try to articulate what is the mission of your agency. And then try to recall a specific objective from a program activity underway in your agency. Something specific and more narrow. The mission statement tends to be very broad, but I'm asking you for a specific objective that is guiding a particular program that you're doing in your agency. So that again is related to needs assessment. We try to base our objectives on the mission of the organization and what we've learned in the assessment process as far as what's missing or what areas still need to be improved. This is just kind of a caveat that's, I think, is common in public health. Someone has said public health does what it's paid to do. That is, we work on funded projects, usually from the next layer up of government, from state government, from federal government. So somebody has money for high blood pressure control, and so that's what we're going to do, is work on high blood pressure control. Or maybe CDC has money for obesity, and so we're going to work on obesity now. There's nothing necessarily wrong with that, but I think maybe you'll see the point. It seems like it would be better if we can do a careful assessment of our circumstances in our community, what is needed to move forward and make it better. And once we know that, then we look for dollars and resources to underwrite and support the program that is needed. And so that's what I mean by public health should be needs looking for funding, but often it is funding looking for a need. And so we accept money from state government or federal government because it's offered and because we can use it to pay our personnel and so on. But it tends to circumvent the ideal process of doing a careful analysis of your community needs first and then trying to find resources to address whatever that is. That's a long-standing problem, nothing new there, but I think it's something that we continue to need to address in our field of public health. Need an asset assessment relies on data, not on speculation, community lore, rumors, or conventional wisdom. That's, I think, obvious at this point, but that sort of is the basic principle behind this webinar, that we have to have data, and how do we get it? So this is a thought question. Do you think gun violence injuries are an important public health problem? That's number one. Do you think that's important? And number two, what kind of data would you want to make your case? And so I'm guessing that many, if not most of you, have already decided one way or the other whether gun violence injuries are important or not, and whether this is an appropriate topic for public health. There's probably a variation in the degree to which people agree with that or think that's a public health problem. Nevertheless, let's just say we have consensus. We think it is an important public health problem. The next question is, what kind of data would you want to make your case? So we don't set our priorities just on a whim or on speculation or on opinion, but it ought to be based on some kind of data. And this is an example. You might intrinsically believe that gun violence is an important public health problem, or you may say no, it is not. but it would be nice to have some data backing that up. And so I'm hoping that this webinar will give you some ideas on how you might go about doing that. Needs assessment projects can have various focal points. Usually we're talking about a limited community, a county or a city. That's probably by far the most common. But it can also be a subpopulation, such as maybe it's the teenagers in your community, or maybe it's people of Hispanic origin, maybe it's refugees, maybe it's senior citizens. And so that could be a possibility for a focal point, a subpopulation. Or maybe there's some kind of a thematic community, such as people who work in factories, or people who work in the public school system. And the thing that makes them a community is the theme of the way they make their living. It could be an institutional focal point, such as we may do a needs assessment for the employees of United Parcel Service in a particular location, or the people who work for a large factory, let's say. So there's an institutional population. Could be the students at a university, so on. So there's a lot of flexibility. We can use the strategies of needs assessment directed at a lot of different kinds of communities. Who usually does needs assessment? I would say most commonly it is done by a traditional public health department at the local or state level. Sometimes federal agencies will do needs assessment. Some of you are familiar with the Healthy People Project, and there is a sense in which that is a needs assessment project, at least in part. So that would be an example of a federal needs assessment. Sometimes in communities there are health planning agencies. I think a lot of those have gone away, but there was a time when we had a network of health planning agencies all over the country, and they frequently did needs assessments. Coalitions commonly will do needs assessment, usually directed towards the reason that coalition exists. So for example, if it's a drug abuse prevention coalition, they're going to do a needs assessment specifically related to drug abuse prevention. They're not interested usually in the whole spectrum of health problems, but just the ones related to drug abuse. Recently, hospitals have begun doing needs assessment projects driven by the Affordable Care Act. They are now mandated to do an assessment and then try to demonstrate how they are addressing the needs that they uncover in the process of examining their community. So if you haven't seen one of these before, this is just sort of an aside. I encourage you to get on a browser, go to your local or district health department, and see if they have any needs assessment data or reports posted. And then once you find that, go in and determine what are their priorities. If you haven't done this for your community, it probably would be very worthwhile, just as information for an informed citizen. Why do we do needs assessment? Because there are never enough resources for all the things we might want to do, and therefore the needs assessment helps us to use our resources in the most efficient way to address those things that have the biggest impact, and not spend money on projects that may be nice to do but aren't really all that urgent. So needs assessment addresses that issue, resource limits. It helps us to be more accountable. After all, most of public health is community-based, and we want to try to be serving the needs that exist. And so the needs assessment process helps us to be more accountable in that sense. There is a degree of efficiency. Let's use our resources in the way that will have the biggest impact on the public's health. And community relevance. Needs assessment usually pulls in representatives from the community And so it's a way of knowing that what we're doing, somebody cares about. It's not just an academic exercise, but it is relevant to leaders in our community. I want to go through several steps for needs assessment. The first one is needs assessment is to define the scope and purpose of what we're doing. We want to articulate ahead of time what is the purpose of doing our needs assessment. What are we trying to learn? What is the scope? Is it narrow or broad? It's important to do some thoughts about that. The example I gave earlier, if a coalition is doing a needs assessment, usually it will have a fairly narrow scope and purpose. If it is a public health department, a traditional public health agency, it may be broader, not necessarily, but may be broader as we look at the entire community. If you're familiar with the Healthy People document, that's almost as broad as it's possible to be, in that it covers the whole range of health problems. Next step, we want to identify stakeholders. Stakeholders are people who have a reason to care in what you're doing. And so these are people that would have an interest in the results of the needs assessment, and furthermore might be interested in working with those results to get engaged themselves or on behalf of their agency. So these are stakeholders are usually various natural leaders in the community, people from different institutions, local political representatives and politicians, folks from government agencies, law enforcement, the business community, the faith community, and so on. The typical usual suspects of various kinds of leaders. Third thing is we want to obtain any existing data. It is worth repeating that we never want to do a survey or do some kind of data collection until we're sure that the data we want doesn't already exist and isn't available to us. And so we try to identify and obtain all existing data that might be in existence now. And that's usually going to come from various kinds of health agencies, maybe the school system, maybe local government, and so forth. We're going to talk about some of those sources. And then we analyze and synthesize that existing data, so we draw conclusions about how does that existing data inform what our priorities should be. And it also will tell us, as we analyze and synthesize, it will also tell us if we have a need for new data that doesn't exist yet. Maybe we have to do a survey because what we want we don't have. Nobody has that kind of data. And so identify gaps in data needs. All right, another kind of a thought question. Imagine in your community you are organizing a needs and asset assessment focusing on youth, alcohol, and drug abuse. Who would be the typical stakeholders you want to engage in your effort? Who would be the stakeholders? I'll give you a moment to think about that. So I hope you've thought about probably parents, because this is, after all, youth we're interested in, so parents would still have a role and very logically would have an interest in this. Law enforcement, since we're talking about potentially illegal activity. Maybe the local business community, people that own retail outlets where alcohol is sold, for example, might want to be part of this, might think of themselves as stakeholders. The school system, because maybe that your interventions will take place there. Maybe the faith community, local government, and so forth. I think you have the idea. I'm hoping those things occurred to you as well. In the case where you don't have all of the existing data you want, then we're going to gather some new data, and that will also include engaging stakeholders. We'll talk about, there's actually a part 2 of this webinar, and in part 2 we'll go into quite a bit of detail about where you can get existing or new data. So that will not be a major focus of this webinar, but if you stay with the next segment in webinar part 2, we'll discuss some of those issues. Once you have some new data, and usually the new data is going to be some kind of a survey, or you did focus groups, or you did interviews, where you collect and analyze data that isn't already in somebody's data set or on somebody's computer. And so we're going to analyze that, we'll draw conclusions, set priorities, and then we will share our findings and integrate that into the implementation. So the existing and the new data, once it's analyzed and synthesized, will then drive the nature of the programs that we decide to do. So a needs assessment is kind of a closed loop. We do a needs assessment, which then leads to designing a program of some kind, some sort of intervention. We implement that program or mount that program, then we evaluate, and that kind of merges into needs assessment. There's a lot of common ground there, which tells us if we have to tweak or fine-tune the program design and so forth, and you continue to go that way. Most things in public health are never perfect. We're always fine-tuning, and so there's always a need for evaluation and ongoing needs assessment. Part of the reason for that is because the community is always changing, so the context changes as well. When we're finished with our data collection and our sort of internal analysis and synthesis, we may write an assessment report. It's really important that this has community credibility, and the only way it will have that is if we partner with the local community and make sure that there is an effort to communicate what our findings were. And so if we write a traditional published report, a printed report, it has to be written, organized, illustrated, and so forth in a way that resonates with the audience we're serving. We want to try to make a narrative that's compelling, that persuades people that the things that we've identified really do matter, and the intervention that it leads to will make a difference. We want to disseminate the results of our needs assessment in a variety of ways that may include media releases for TV, radio, newspaper, and so forth, holding stakeholder meetings and public meetings, maybe something on the web, email and social media, and traditional print documents that we've used for years and years and years, and they're typically distributed either by mail or at public meetings. Imagine you are preparing a final report on a needs assessment project that you've completed. What does the phrase "styled for audiences" found in the previous slide, what does that mean to you? And how would you incorporate that concept into your report? I want you to think about that for a moment, think about that for a few moments, and then we'll talk a little more. So styled for the audience, styled for audiences, might include concerns about readability. Is there a level of health literacy in the population you're serving that would demand some special measures be taken so that any kind of information, whether it's electronic or printed, is disseminated in a way that is accessible to people. People can read and comprehend. It's graphically designed in a way that leads the reader's eye from concept to concept. You're using relevant cultural meanings in terms of graphics and so on. A lot of it has to do with the print design, graphic design, the color scheme, the layout on a page, the reading level, and so forth, is most of what we mean there. It may also mean the the kind of material. So if we're dealing with traditional middle-aged adults, maybe a printed document of some kind of report is totally useful and well received. For other audiences, they may be more interested in something along the lines of a blog or electronic document of some kind. Now, I want to make a connection here. I know a lot of local health departments are using a process called MAP, which stands for Mobilizing for Action Through Planning and Partnerships. Embedded in MAP, let me back up. MAP is a strategic planning process that communities use to further improve the services that they deliver and to better understand their community so that they can serve it more efficiently. It's more than just a needs assessment. There is an implementation part of it. So I want to make sure there's no confusion. MAP incorporates a needs assessment, but it is more and bigger than that. This webinar is primarily talking about needs assessment, but if you've been through the MAP process, you have also been through a needs assessment process. And in fact, within the MAP design, there is a whole section called Community Health Status Assessment, and it is a needs assessment process in much the same way we've been talking up to now. So in conclusion, public health must be based on demonstrable needs and assets in order to most efficiently address the most pressing priority health problems in communities. As we move over to part 2 of this webinar, we'll talk in more detail about very specific data concerns. And so that brings us to the end of this webinar.